Hey, your joints, just like everything else, are affected by age and use or lack of use of those joints. Your joints are going to become more flexible as you use them, become stronger as you use them. They actually get bigger. The capsules get bigger as you use them. You get bigger, large ligaments and bone markings, bone attachment sites as you use the muscles and the joints. Unless you overuse a joint, at which point it can actually calcify and become a synostosis. Remember, that's what happens. That's what we call the sutures in the skull. Once they've fully fused, we call it a synostosis. If you injure a joint, or in some cases, age and damage, just use-related damage, can actually fuse a joint. Now, there's some age-related fusions that are normal, like the coccyx with the sacrum. That joint between the coccyx and the sacrum can become a synostosis. You would not, however, want that to happen in, say, a finger, but stranger things have happened. So now you're going to ask me, how do I know what is using the joint a good amount and what is too much? If it causes pain, don't do it. And yeah, we don't really know besides that. So use your joints, but don't hurt yourself. Okay. Arthritis is anything that damages the articular cartilage. Osteoarthritis is a form of degenerative arthritis. It's the most common form of arthritis, and it's usually a result of wear and tear. Sometimes it's just a part of normal aging. The articular cartilage starts to break down, especially when synovial fluid gets squeezed out of the joints. It can actually, if you overuse and overstress the joints, they can actually get overcompressed, harming the cartilage. Normally, though, of course, using the joints makes the joints healthier because it helps to push fluid and nutrients into the cartilage. So again, how much is too much? If it hurts, it's too much. I know that's not a very good rule of thumb, but it's the only one we've got right now. So extreme exercise or extreme repetitive use of a joint can lead to osteoarthritis. And this could happen, because of exercise, or it could happen because of repetitive use because of your job. Say you're a grocery checker, you have the danger of having arthritis in your hands, wrists, and shoulders because of the repetitive movements you do. Or like if you are a video gamer and you play video games for hours and hours and hours a day, you could get, I cannot talk, osteoarthritis in your fingers because of that. Now, gouty arthritis, or usually just called gout, it's usually not actually thought of as a form of arthritis, but it does cause joint infection. And it results from a buildup of uric acid in the blood. Uric acid is a byproduct of some metabolic processes. It's usually removed in urine by the kidneys, but especially if you're under stress, it's more common in older people. But in times of acute stress, sometimes uric acid builds up in the blood and it accumulates in joints, especially in the joints of the lower extremities, especially the feet. And you can imagine that these crystals of this uric acid accumulating within the synovial fluid within a joint cavity could be extremely painful. So this is a painting from the 18th century, from 1799, showing what the pain of gout apparently feels like. So it apparently feels like a little demon chewing on your foot. And you can see this very, very swollen first metatarsophalangeal joint, and that is a classic symptom of gout. So one way to avoid gout is to avoid stress. That's funny. But also just drink plenty of water so your kidneys have plenty of water to help them remove as much of that uric acid as possible from your body. Now, rheumatoid arthritis is a form of arthritis that usually develops in young people. Sometimes people get it in middle age, but a lot of usually if people get it quite young. And it is an autoimmune disease where the body's immune system starts to attack the cartilage and other structures in joints. Pain and swelling of the joints is the most common symptom, also muscle weakness, and it can lead to osteoporosis, actual breakdown of the bones themselves. If left untreated, it can lead to blindness. We do have some treatments for rheumatoid arthritis now, some of which involve limiting the ability of your immune system to do its job, which means that it's not attacking your tissues, but it also means that it's not protecting you against other things. So obviously there are some side effects to be considered. So that's our discussion of articulations and the end of chapter 9.